Hello and welcome everybody to another episode of the Evolving Practice Podcast. I'm Dr. Bill Moss and I'm with,
Hi, I'm Dr. Sean Carey.
and we're excited to share another episode with you. This episode is entitled The Hidden Truth of Chiropractic. And if you listen to our introduction to the podcast, or if you've been listening to us along the way, you know that Dr. Sean and I are both chiropractors, energetic healers, teachers, and spiritual guides. And we, through conversation, wanted to take an opportunity to, kind of go into the breadth and depth of what the heck chiropractic is. We shared our story, and it might be good to just share some of the details of um, why we entered that profession. But there's a lot of misunderstanding about chiropractic. There's a lot less misunderstanding now than there was years ago. I think we've both been in practice, what, 12, 13 years?
Yeah, right in that neighborhood.
Right. Right around there. And things have really changed over time, and and the public's understanding of what chiropractic is and the use of it. But we just want to go into some of the the hidden things that you
Yeah.
probably don't know but really should know. So if you're a chiropractor, this episode might not be as much for you, but it really is for the public and the people that we serve, so they can understand the breadth and depth of what this profession is, how it can help, and then also kind of the BS that gets thrown out in the public about what is chiropractic and what isn't. So I'm looking forward to kind of diving in with you, Sean, on this. I'm sure there's a lot of themes you'd like to talk about, but what would you like to start with regarding this topic?
Oh, well, maybe we can go back in time a little bit and talk about
Okay.
kind of the history with chiropractic.
I
So,
think Cool.
yeah, with chiropractic, uh, when chiropractic first came out, it was there was a man named D.D. Palmer who was a magnetic healer, and he had a janitor who worked at his building. And the janitor reported that he was deaf. He was working under something, basically heard a pop in his neck, and then after that point, he was deaf. And D.D. Palmer was a magnetic healer, and he looked at the man, he evaluated the man, he saw that there was a lump on his neck. He's like, I wonder if I basically push his neck back into the proper position, if that will do anything. And so that happened. He did that. You can imagine probably a karate chop to the neck, and the first chiropractic adjustment may not have been the prettiest.
Yeah.
But after a few times of that, the man got his hearing back.
Mm,
So D.D. Palmer, the first chiropractor, thought he found the cure for deafness.
mm,
And as you can imagine, like the thinking was just very different at that time. Everything was about symptoms.
mm.
So D.D. Palmer then promoted, hey, I have the cure for deafness. And all these other people came in who had deafness, and
Yeah.
none of those other ones got their hearing back. But what did happen is they started having other issues get better. They had
Mm,
heart issues get better and lung issues get better, and many different pieces. So they actually had to look and say, okay, what is actually happening? People are getting better, but we're not quite sure what the consistent theme is here.
mm.
And it was like that was really the roots of chiropractic, and maybe even the roots of where it clashed with medicine
Yeah.
was because there was it was a totally different way of thinking. And even D.D. Palmer had to say, okay, what is actually going on the surface? Why are people getting better? And that led to the understanding that chiropractic is all about the influence it has on the nervous system.
Yeah. Yeah.
And the nervous system we know is the master control system. It controls everything in the body. So it's controlling the immune system, it's controlling the digestive system. It's all those details of how your body's functioning, your lungs breathing, your heart beating, all those pieces. It's
Mm.
all governed by the nervous system. And
Yeah.
chiropractic is so important because it protects and greatly influences that nervous system. And if the spine is out of proper alignment to a point where it's affecting the nervous system, we call that a vertebral subluxation. When that's happening, the nervous system is basically misfiring. It's a huge problem.
I No, I love it. Now, it's like a perfect like lay lecture representation of
Yeah.
kind of the whole entire evolution of what it is. And I think that kind of leads to like the first misunderstanding, if you will. And I feel like this is less of a misunderstanding. The one I'm going to first
Yeah.
introduce is the idea that people used to regurgitate like, oh, you chiropractors, you think you can heal everything. And I love addressing this for the fact that I'm sure we can share multiple stories of many, probably hundreds of stories of people who had improvement in areas that they didn't even tell us about when they first came to the office.
Yeah.
And also areas of improvement that weren't the original one. And let's say that the original thing somebody came in for didn't get better, but a whole slew of other different conditions that were going on with that person did get better. And that's not because chiropractic cures everything or is quote a cure for everything, but it has to do with that there is this natural understanding for people that if the body is given the right conditions, optimum function through its internal environment responding to its external environment, it will heal. It's always striving to heal. And chiropractic's part is in making sure that the function and coordination and adaptation of the nervous system is performing at its highest, because that then the body starts to handle things. It can handle the demands of what's been going on. And we've all seen that across the board. So it's not that chiropractic cures asthma or fibromyalgia or migraine headaches. It's that if the body is working in better harmony, these things tend to take care of themselves over and over again.
Absolutely. Yeah, for your body to have the best chance of healing whatever the issue is going on, and it could be whether you have migraines or whether you have cancer. We want
Mhm.
that environment to be optimally healthy, and part of
Mhm.
that is the nervous system functioning at its best.
Totally.
And when the nervous system is out of balance, the body is it's not in a state of harmony. You simply can't it defies the physics and how our body is structured. You
Mhm.
aren't going to be at your optimal health if you have vertebral subluxation, meaning that the spine is misaligned to the point where it's affecting the nervous system.
Yep.
So when there is that aberration, when there's that misalignment and the nervous system is irritated, it causes the nervous system to go into more of a fight or flight mode, a sympathetic mode where the system's overly stressed.
Yep.
It alters many different aspects of nervous system function,
Mhm.
and you can't be optimally healthy when that's happening within the system.
Yeah. Sometimes I almost draw the picture with that when you say like the fight or flight or the
Yeah.
sympathetic, if you want to get more technical, like people, the majority of people, many people are stuck in like sympathetic overdrive where their body is in like fight or flight, like a tiger's chasing it just throughout their regular day. And neurologically speaking, that tends to create like a traffic jam. And if you have a traffic jam, um, it's like the road slowed down, right? But if people take it in their own hands to drive on the shoulder or drive on people's front lawns or and create this chaos, that's kind of what happens in people's nervous systems is like different highways or roads get stimulated that otherwise wouldn't be, and you start to have this global dysfunction in the body and in the system. And it's quite an amazing thing to see that change. And that's one of the reasons I say to my clients, like one of the biggest things that changes, regardless of what condition they're dealing with, is sleep. Because if the body can start to swing, if they can swing from that sympathetic overdrive state into this rest and digest parasympathetic state, like people repair um, and they get better sleep and they have more calm demeanor and they get this level of rest that they weren't really receiving before. So, from a functional perspective, some of the general things I see with most of my clients is better sleep right away, better motion movement, a sense of like greater posture and, flow and uprightness, if you will, that
Yeah.
most people, regardless of the condition that they're experiencing, tend to see a difference in also.
Yes, 100%. And one of the things along that note is to be better breathing too,
Mm.
because clearly what
Yep.
happens is that the rib cage is more easy to expand when the ribs are properly moving, when the spine is properly moving.
Mm.
You'll see less anxiety is one of the things that I often see.
Yeah.
Improved digestion, those are and improved sexual function, those are
Yep.
improved immune function, those are very common.
Mhm. Yeah. They don't always tell us about them, right?
Yeah.
Not
Absolutely.
every one of those topics are like, "Hey, doc, I wanna tell you about it."
Yeah.
But oftentimes, I tend to work with a lot of people that carry anxiety around. I mean, that was my story into chiropractic was, I had been utilizing chiropractic for years with very strong benefits from a performance perspective. And some of the things you said, I just had better recovery. My breathing, I was an asthmatic and I had seasonal allergies, and all that started to go away. But I saw the biggest benefit, or maybe, I wish I didn't even get to the state where I had anxiety and panic attacks, but
Yeah.
chiropractic really helped me snap out of that state where my body seemed to find an ease that I didn't experience before. And it really drove me to become a chiropractor. So I tend to work with a lot of people that have struggled with anxiety. And in my opinion, it's become so much more common in the last 4 years, where I would even describe like the nervous system the state of people's nervous systems is, uh, it's like a bucket that's like higher, and it only
Yeah.
needs a little more water until it's spilling over. I know we've used that analogy, but it really
Yeah.
accurately displays like people are walking around with a heavier backpack with more
Yes.
weight on their system. And
Yes.
that's why we're seeing a lot of conditions. And early in COVID, through just the state of the world, I saw a lot of old conditions come back for my clients because
Yep.
that load of stress on their nervous systems was even higher than it had been in years.
100%. And along with that too, it's one of the things when we see that people are having that overly stress, that backpack's too heavy,
Yeah.
the pot is just so full of water. We'll see a lot of different chronic health conditions.
Yeah.
So and we're going beyond the low back pain, beyond the neck pain, beyond the headaches and
Yep.
those pieces. And oftentimes people get really sick because their system's been so worn down. So
Yes.
bringing that system back into a state of harmony and helping get rid of the literal stress, like we may perceive it as anxiety,
Yep.
but literally what it is for the nervous system, it's too much stress. It's not able to regulate it. So a chiropractic adjustment is so amazing at helping to recalibrate that.
Yeah. It is a really big pattern interrupt, right? To
Yeah.
the state of where that person is. And, even the type of chiropractic I do, upper cervical, I do what's called pattern work. But there's so many people, I think people can relate to patterns and also being stuck in a pattern, because there's almost all of us have behaviors that we repeat and we're like, oh, why do I keep repeating that? Well, it's like we kind of relive our day over and over again in many ways, physically and
Yeah.
mentally,
Yeah.
where we have the same thoughts, we do a lot of the same behaviors, and we get stuck. And a chiropractic adjustment is such a movement, or like it helps with inertia to, like,
Yeah.
get somebody moving or into a different direction, or further in the right direction. It just has this movement element to it that helps people like snap out of it, and
Yeah.
like also bear witness to really like where they were. I see this all the time
Yeah.
where people go away, right? They're under care,
Yeah.
they got a lot better, let's say in a month's time, and then they're doing really well for a while, and then you don't see them for like 6 months, right?
Yeah.
And then they come in and they get checked and they get adjusted and they walk out, and what do they I'm gonna put you on the spot. What do they usually say?
They're like, I forgot I could feel like this.
Yeah, exactly. It's like, because we've adapted to this new state of like,
Yeah.
I'm doing really well, is, oh my gosh, I didn't realize how bad I was. And I got a massage like 2 weeks ago. And I go to a girl pretty regularly, like once a month, and I hadn't been for like 5 or 6 months. And I walked in and she's like, how are you doing? How's everything? And I'm like, oh, it's really good. Everything's okay. This is like a wellness massage. And she gets working on me, and I was like, "Oh my god, I'm a mess. When should I come back? Like, I
Yeah.
should come back
Yeah.
sooner."
Yeah.
Because I had no idea. I actually didn't know
Yeah.
until I knew, and that happens all the time. So then it begs the question, like, how the other, myth I wanna talk about is, like, how often should someone get checked, right?
Well, absolutely. And that's when we talk about patterns, oftentimes like that's a critique somebody might use with against chiropractic, or they're saying, I don't want to do it because I have to do it. I have to repeat it.
Right.
But the reality is we do live in these patterns just like you're talking about. And if your body has been a
Yep.
negative pattern where things have been misaligned and the muscles have had to change tone, it's altered your movement patterns. You don't even realize you've been walking funny for 20
Right.
years. Like it's
Yeah.
so when we do the adjustment, it takes time. The body's tendency is to basically try to pull back to that misalignment and that old pattern. So
Yep.
we have to check it and make sure that you're not going to that pattern and when you are, we correct it so that
Mhm.
you get to create from a new space. A chiropractic adjustment literally helps the nervous system to fire in a new way.
Mhm.
So that's
Mhm.
it's like coming out of a box. It's like leaving that old pattern,
Mm.
and you get to work in a completely different way.
Yeah, and I like to kind of reveal that it's a process, right? And we've
Yeah,
talked about this in other episodes, but the idea like healthy things are all based on process, right?
yeah,
And chiropractic fits into that level of health and wellness understanding. Like it isn't a medical intervention that like an
mhm,
emergency needs to be done. It got put in that box to some degree, but the reality is, and this is what I like to uncover with people, is like if you went to pick up something and your quote back went out, there was a level of dysfunction that's been building for years
yeah,
because you weren't prepared to handle the demands of the piece of paper.
yeah,
Like that's
yes,
why that something in the system broke down, and that process built over time. And the same way to restore it is there is a process. There is a process of removing these layers and these patterns. And then I always say once we've done the initial work, it's always up to the other person what they want to do. But what many people do want to do when they improve is they want to maintain that improvement. In the same
yes,
way that, like, if you do a complete diet overhaul and you get to a level of weight and performance and feeling like if you make the same choices you were doing back in the day, you're not going to maintain it. And the same way, chiropractic, there can be a maintenance that is not nearly the level of uh, the initial work that was taken to get to that point.
yeah,
And I usually put it in my clients' hands and see what they want to do. And many of them pick their interval. They almost decide, like, hey, this is because I also believe that people will come to an understanding of themselves to understand when it's appropriate to get checked,
yeah,
but it's usually an interval, right? And that's
yeah.
that's what I find. Yep.
Yeah, 100%. And on that note of one of the things that's important to understand is our body is a living system, and all
Mhm.
living systems you basically need to take care of.
Yep.
So, even your lawn, like what happens if, you take really good care of your lawn? Like
Yeah.
during COVID, one of the ways that I processed my stress with COVID was I worked in the yard like every day.
Yeah.
So I had my yard look awesome. And then the past couple of years, I've been slacking on the yard, so you can see all the weeds and the bushes and stuff are getting bigger and
Yeah.
that type of thing.
Yeah. Yeah.
And because it's a living system, we have to maintain it. Same thing with diet and exercise, like you were saying, you can get in amazing shape, but then you can also let it go because you're not maintaining that living system.
Yeah, and it's not even just like if you s if you actually go backwards, right?
Yeah,
If we stop eating well, if we you stop taking care of your lawn, it doesn't just stay to the state that it was, it actually goes backwards. So it's like as soon as we stop working out, stop moving, and people do understand this, and I like to have this conversation is when we get less movement in our life, which is what a lot of people do when
yeah,
they get injured. Let's just use it on a purely physical. If the body becomes injured, what do people do? They actually stop moving. And then when they stop moving, they can't go as far and they get stale in many ways. Like many movement patterns get stale and then we get stuck. Uh, and that's kind of like what happens if you uh, injure your arm throwing a ball and you can only move it in a certain way. The
yeah,
reality is most people never go beyond that. And then you never correct a problem without that, without going beyond it and going further. So
yeah,
chiropractic, we have to like reopen the ability to get people kind of moving in a
yeah,
direction that allows them to go beyond physically and to push a little bit further. Because as soon as we stop moving, we really neurologically, like our
yeah.
brain doesn't work as well, our physical body doesn't work as well, and all that. Much of that movement and motion has to do with the spine and the nerves and muscles and everything surrounding it.
100%. And to your point, when we talk about the intervals for chiropractic maintenance, one of the reasons that we do that is because there's different research that has shown that when you immobilize a joint for a period of 2 weeks, it will actually degenerate. You can get a level of permanent degeneration in that joint,
Yep.
meaning
Yep.
that you take a teenage baseball player, they hurt their arm, they break their arm, they're in a cast for 2 weeks. They can actually build up arthritis in that joint in the span of just 2 weeks.
Totally.
So when we are able to go and evaluate the different joints of the spine, we're able to catch that stuff before it has a chance to set in for a long period of time and create a negative pattern.
Yep. Yep. Yeah, 'cause what's one pattern usually lead to? Another one, another
Yeah,
compensatory. And, we
yeah,
see, like, the world is becoming dysfunctional for many different ways. The initial shift can definitely be because of an accident, but it has most of the time to touch on, like, the little micro things that we do over time, or don't do, that really build up to create the picture that a person walks in with. So, from a perspective of, like, I know I can speak for myself and probably you, is like, we really do care about people's story
yeah,
throughout their life, like how they get here, because
yes,
again, that process has brought them to a moment of dysfunction where they decided that they wanted to do something about it. And it's usually because, here's the other reason, like, why would you go to a chiropractor, is I like to paint the picture is like, everyone spends a day or so in pain in a year's time. Like, we all deal with some discomfort, but
yeah,
it's only when that level of discomfort or interruption, um, or the chronicity of whatever's going on, it starts to interfere with the things that they love to do,
yeah,
where it becomes a big enough driver to do something about it. And, that's why people actually come to see us. It's not just pain. It's actually because something that uh, they love doing or participating in starts to become limited.
yeah,
That's really what a great client turns out to be in my office.
yeah, absolutely. Um, one thing I wanted to mention that just keeps popping into my mind during this conversation. At one point in time, there was this notion that the spine influences the nervous system and it
Mhm.
influences those nerves that branch off. It was accused basically to chiropractic that no, that's not true at all. It doesn't work that way.
Hmm.
So there was these autopsies done. It was basically a study done to disprove chiropractic, and I believe it was called the Windsor autopsies. I don't know if you
Yeah.
remember
Yeah.
those. And I think I believe, I don't have this right in front of me, but they took around 150 different cadavers and they
Mhm.
looked at the cadavers. And what they were assessing was if there's any link between the health of the spine and then the different organs. And
Mhm.
what they found was in like over 90% of the cases, there was actually, when there was spinal degeneration, when there was a significant problem in the spine, there was also a problem in that organ that was associated,
Mhm.
where that
Mhm.
spinal nerve was going to these different organs. So I think something that's really important to understand for people is that there's a level of maybe acceptance as far as people think that their body's just going to break down and they're going to have
Yeah.
all these problems as they age. And with chiropractic, you have its most powerful gift is really the prevention aspect. By
Mm.
properly taking care of
Yeah.
your spine is the things that you don't have, the injuries that you don't get. That it's like you're not preloaded with so much stress that
Mhm.
your back doesn't go up when you pick up that piece of paper that you talked about.
Totally. Yeah.
It's the nerves are getting through properly to the liver, so that piece is working properly, and you're not coming down with some type of sickness there.
Yeah.
I like to use I also like to tell people, like now, if you look at the health of people's teeth now,
Mm.
most people's teeth are very, very healthy overall.
Yeah.
Compare it to the health of people's teeth like 80 years ago. Now we drink, we eat more crap, we do more soda, more sugar, all that stuff by exponential amounts. But people have healthier teeth, and it's because of dentistry.
Yeah.
Dentistry has done a really great job as far as promoting the importance of prevention.
Mm.
So
Mm.
that's something that people just don't understand that link with chiropractic yet. But by properly taking care of the spine, not only do you tend to feel much better,
Mhm.
long term, you're going to prevent a lot of different problems.
Yeah. Yeah, and I would say, my first initial contact into chiropractic was, I definitely was resilient. I was a
Yeah.
competitive athlete, a Division II cross country and track runner, and I had these aspirations at a young age that I wanted to do, like, Ironman triathlons, and I, like, was like, if I did that, if I competed one day, I would take my chiropractor wherever I went. Like, that was,
Yeah.
even at a young age, because I saw the resiliency factor of where there was a hitch or a hiccup in my recovery or my training, and I just saw, like, a different boost. And that's the real reason chiropractic has survived, is it doesn't have to do with every aspect of it, being accepted by
Yeah.
every authority and community, but it really has to do with the outcomes and the experiences that individuals have, because really it's the results that kept the profession alive through, there were many different entities that tried to like squash the whole thing. And
Yeah.
there's a book, I don't know if you read it, Medicine, Monopolies, and Malice, I think it is. And it was basically about how like the AMA tried to like shut down all natural health um,
Yeah.
professions in like the 80s and kind of just squander their ability to with the quack stuff and all of that. But it's like everyone knows at this point somebody who's been helped with chiropractic. So
Yeah.
it's always funny to me, like maybe 12 years ago, people would come in and say, "Oh, I don't know if I believe in that." Like
Yeah.
chiropractic's a belief system, and it's like that I have seen shift over the last 10 or 12 years. I almost never hear that from somebody like, "No, I just don't
Yeah.
believe in that." It might be like what people were hiding behind is they're scared. I think that's
Yeah.
the biggest limiter of why
Yeah.
people don't go see a chiropractor. I think the biggest misnomer is that people are scared
Yeah.
ultimately.
Yeah.
Um,
I agree, and I think unfortunately, sometimes people's exposure now to chiropractic may be like on YouTube or TikTok or that type
yeah,
of thing,
yeah,
and it's kind of unfortunate how there's just a level of glamour that's being put out there, or not glamour, but it's like the shock value of let's
yeah,
hook all these microphones up and then do a brutal looking adjustment because it makes so much sound and it will get 500,000 views.
yeah,
But it's really not like that. If the care we do is so specific and precise.
yeah.
It's important to properly take care of the spine, and when you do that correctly, it's such an incredible force of healing for the system.
Yeah, totally. Yeah, and I think what people don't know in the context of those videos, and you see them all over YouTube and TikTok
Yeah,
and Instagram. I mean, they exist, and the reality is a lot of those people do fine, and it's just it's glamorous. But what what people
yeah,
where it kind of hurts is if somebody says like, "Oh, I take my child to go see a chiropractor," and first off, if you've been listening along, you're like, you probably can start to theorize why somebody would bring a child. Now, a child's never going to say, "Hey, I'm in pain. Something's really going on." I mean, if they are, that they're probably old enough to have that experience where they can
yeah,
acknowledge that something's off. But really young infant children, dysfunction shows up in different ways: colicky, reflux, ear infections, not sleeping, not hitting milestones. All that is quote dysfunction, and we've both worked with many clients. Now the adjustment doesn't look anything like you see a
yes,
35-year-old adult male athlete.
yeah,
Doesn't look anything close. There's special populations, and it looks very different for
yeah,
a 1 month old and a 99-year-old compared
yes.
to a 35-year-old. And actually, one
That's a
time in
great point.
practice, one day, I started a 1 month old and a 97-year-old. They were born almost 100 years apart, and starting in the same day of care. And they were drastically taken care of very different than those videos you would see online, because a
Yeah,
true artist in the healing arts knows how to work with various populations and to
yeah,
adapt to best serve them. It's very different than just racking and cracking spines up and down. And that's why we do use objective measures too. It's not just about feeling around. When people can't find what I do, it's like good questions to ask are like, is the chiropractor doing objective things like thermography and X-ray and doing an exam before they see
yeah,
you?
yeah, yeah. It's really really important to have those pieces because that does allow you to have the best care and then for people to get the best results.
Right.
And yeah, chiropractic is something that is unique in that it's a healing art. So like if you go to the pharmacist and you take a medication, if like you take an antibiotic,
Mhm.
that antibiotic is going to be the same no matter which pharmacy you go to. It's going to be the
Yeah.
same thing at the same dosage. But with chiropractic, the technique matters. The practitioner
Yep.
matters. It's like you can go to 10 different chiropractors and have 10 different experiences. It's
Yep.
not going to be the exact same thing. So it is really important to find somebody that you connect with and that you resonate with and that actually understands your case.
Totally. Yeah, that's great. And maybe that's a good thing to kind of talk about is I kind of mentioned a few things, but there's many people who are seeking chiropractic. And what I'm finding is over the years, there is a lot more of like, I went to a chiropractor, it didn't work for me, but I know I can find a relationship that's going to work for me.
Yeah.
Right. Where years ago, it was like we kind of had one shot to get it right. Where
Yeah.
maybe if you didn't like your dentist, you'd go find another dentist. But chiropractic, in its essence, we've had conversations surrounding like, you are the shot in many ways, and people aren't going to give it another one. And there are still people in the population that are like, I tried that and it didn't work and it's not for me, or whatever it may be, whatever
Yeah.
the um why they didn't like it. But what I'm seeing is there are a lot of people that are recognizing that maybe it wasn't the right relationship because maybe they didn't do an exam and maybe they didn't listen to you. Like there's
Yeah.
we take care of people, and that care begins with our staff and it continues into the exam that we do and the connection.
Yep.
We've done many episodes on what it the importance of a the relationship and what's behind the person that you're working with, and that matters in this relationship very much so. And I can say on this podcast, like if you're drawn to chiropractic and you're like, I want to give it a shot, you can always reach out to us because we know people all over the world
Yeah.
that um, will have more, that will have pieces and aspects that can help you get the type of care you're looking for.
Yeah.
Yeah. Yeah.
Absolutely. Yeah. Reaching out to, you're always welcome to reach out to us. And
Mhm.
we have an amazing network where we can look and find different people there.
Yeah. And you can actually email us at hello@evolvingpracticepod.com. And we can really reach out to you or connect on Instagram too at the Evolving Practice Pod on Instagram. So, those are some ways. What other things do you hear on a regular basis that you feel like we should address in the chiropractic world? Um,
Well, I think one thing that's important to mention is that with chiropractic, patients who choose to utilize chiropractic as a form of healthcare,
mm,
they tend to be extremely satisfied. There's been lots of different assessments. They
mm,
tend to be extremely satisfied with the care that they receive. Uh, Patients are much less likely to end up on medication or on the
that's
surgery
good.
table.
Yeah.
So people have some really great all around outcomes as far as using chiropractic care as a part of their overall health plan.
Mm,
And that's one of the distinctions that I really want to kind of address here. Oftentimes, when somebody comes to the office initially, it's because they have some type of pain. They have back pain, neck pain,
mm,
headaches, whatever it is, and the focus in the person's mind is just on that pain. And really, what we want to do is we want to break the pattern, help that person get to that optimal state of function, and then to maintain it where it's not about the pain anymore, but it's about that optimal function
yeah.
over a long period of time,
Totally.
because it's really that long period of time where you keep the spine in a healthy state for a long period of time, the nervous system in a harmonious state for a long period of time. That's where we see the biggest impact.
Hmm. Hmm. Yeah. And what I found is that clients, when you practice long enough, you have a lot of people return. And I always like to communicate with people when they've gone away for a while and we did this work together. It never takes as long to get back
Yeah,
because there is this understanding that your nervous system kind of knows the work that we did.
yeah,
And then when we start doing it again, it remembers. It's like sounds cliche, but like riding a bike.
yeah,
You might not be as skilled because you haven't done it for years. You might not be as confident, but very quickly through a few rides, you start to get back the your legs, if you will. And that same thing seems to be true because when we work with the nervous system, it does develop this relationship and this understanding in its response to what's going on through the adjustment. And I found that over the years, like it's wild to me how quickly people's body like re gets the hang of what the work that we
yeah,
did and really gets more efficient at the process of remembering, if you will. And we said it years ago. The nervous system isn't just when you're working on the nervous system, it's the endocrine system, it's the
yeah,
autonomic, which is the process, all the pieces that you and I don't have to think about. It's the immune system. And through the chiropractic adjustment, there is an influence into these systems. There's research that supports that over the time. So we've seen it through the results that people get, but there's also a backing of scientific literature that continues to show how that process actually occurs.
Yeah, and there's a huge relationship too, as well as different degeneration, like different
Mm.
spinal degeneration and those types of things. Because the better the spine is moving, the less stress is going to be concentrating on specific areas of the spine. So one thing that's important to understand is that the spine should work in harmony. There's 24 different bones that should move together. It should all work as a singular
Mhm.
unit. But
Mhm.
if you have misalignments in the spine, it'll cause different areas to basically get stuck, to move improperly. Then there'll be extra stress there. That leads to extra wear and tear. That leads to all sorts of problems like bone spurs, arthritis, that
Mm.
type of thing. And by having the spine move properly and be in balance, you really get to dodge a lot of bullets that way.
Yeah, that's awesome. That's awesome. I know you've had a ton of cool cases and fun stories over the years. What's one you'd love to share? Either recent or over the years that's been like, oh, this was just like one of your favorite cases to work with.
Yeah, there was so one of my favorite cases was I had an assistant of mine at the time who I had hired this person who Britta,
Okay. Yeah.
and she started working for me, and so this was a person from a job ad,
Mm.
and basically it wasn't anybody who she didn't have an understanding of chiropractic, but I needed somebody to run the front desk and answer phones and that type of thing. And maybe a couple weeks into care, I was like, hey, I want to bring you through the new patient process so that you have an understanding for when you're talking to patients on the phone, to new patients, like you actually understand what they're going to go through. And she shares this story publicly all the time. We've had different testimonials with her, but I had no idea that when we sat down for that exam, she was on about like 15 medications, and we're
Wow.
talking about somebody who was maybe 22 years old,
Wow.
and she was on medications for so many different things. Migraines so bad she'd be temporarily paralyzed and couldn't walk. She had severe food allergies, and then just multiple medications. She was actually going to get blood work done. I believe it was every 3 months because they were constantly checking her liver enzymes to make sure that her liver was still functioning with all the medication she was on.
Wow.
And it had gradually worsened over the course of um, most of her life. She started getting air flighted to the hospital as a young child with asthma. She was on multiple asthma medications too. That was part of it, but just such a medication cocktail, and it was just more medications got piled on over time. That then you have this 22-year-old girl on 15 medications.
Yeah.
So we end up doing the chiropractic evaluation. Uh, Saw scoliosis in her spine, where the nerves are branching out, going to the lungs, and different problems that she had, and just started getting her under care, not for the treatment of these things, but just because it's
Mhm.
important to have a healthy spine, so you can have a healthy nervous system, and so that she could understand to be able to communicate to patients. She went for her next checkup. And her medical doctor said, "This is the healthiest I've ever heard your lungs. Let's start taking you off these medications."
Mm.
And they took her from like 15 medications down to two.
Mm.
And it was just such a incredible turnaround. And she's
That's
such a
awesome.
huge chiropractic advocate from that experience.
That's really great.
Yeah.
Yeah. Yeah.
How about you? I'd love to hear one of your
Yeah,
stories.
I think I feel like this is the story that helped me earn my wings in
Yeah.
being a practitioner. It was my second year of practice. I was an associate in an upper cervical practice in Georgia, and it was a very busy practice. We saw a lot of people, and the one we would do like I think a biweekly orientation that was kind of just almost like what you and I are doing. Going into
Yeah.
the deeper understanding of chiropractic for our clients. This was directed for our clients. And one of my clients, she, I don't remember how old she was, but at the end of it, she comes up to me and she's like, listen, my granddaughter is 17. And over the course of the last 2 months, she's had like 56 seizure like episodes in like 71 days or 61 days. It was like almost a seizure every single day. And it was getting to the point where she was losing speech. She wasn't really cognizant of her name at certain points, and she wasn't going to school. So mom was like, "Do you think this could help her?" And I was like, "Well, let's give it a shot." She was living in Pensacola, Florida. I was practicing in Atlanta, Georgia, and the girl, I think her name was Lindsay, she wasn't going to school, so they basically moved her up to live with grandmother for 6 weeks, 8 weeks, I think total. And we did about 8 weeks of intensive care. And during that time, she only had one seizure during those 2 months. And they wanted to do like really extreme treatments for her. Like they were talking about like removing part of her brain to get these seizures to
Yes.
stop. She was on different medications. And at the conclusion, I'll never forget, I was sitting down with her mom, basically like, and mom's like, she had come up for the initial and she had come up for like the reassessment and stuff, and she was like, we really want to get her back into school because now she's starting to get depressed because she's away from her friends
Yeah.
and she wants to get back to her regular life. And the only time she had a seizure, she had like an absence one, was in the office after an adjustment, and that was the only one, and that was the only time. But we had the tools and to measure, and what kind of life was that? Where was she going? So that really helped give me the confidence to like take care of a really serious case,
Yeah.
and look at how the body can restore the speech return, the language return, the because the body could function the way it was intended to. So that was kind of one of the biggest stories I've ever experienced, and really helped open my eyes to the bigness of chiropractic, but then also my ability to really take care of people. Yeah.
Yeah. That's a really cool story.
Yeah. I forget it. Isn't it funny though? Cause like sometimes, I ask you that question. I'm like, watch, Sean's gonna freeze and be like, I don't remember any of them. Because the reality is we kind of get used to this
Yeah.
because I know I'm at the point in my career where like I do expect people to heal. I really do.
Yeah.
And I know you feel the same way. And I think that's the biggest factor. Like if you're working with any practitioner anywhere and they don't think that there's potential for you to heal, like then there's going to be less potential for you to heal, because
Yeah.
that relationship 100% matters. And the more we see it, the more experience we have with it, the more we can believe. And maybe that's not for you. You don't think that that plays a role in the healing process, but over time I've come to know it to be true. For sure.
Yeah. Yeah. The competency and the confidence of the practitioner is a huge deal. And the
Yeah,
reality is that not everybody takes on. There is a segment of the chiropractic population where they really just focus on musculoskeletal
totally.
cases, and it's not about so much about nervous system function or harmony or healing the chronic pieces. So,
Mhm.
so finding the right person to work with, the right provider, is super important.
Totally. And again, we just reiterate, as we wrap this up, like if there's, something about this podcast and your understanding of chiropractic that's grown and you just want to tell us, great. But if you also want us to find a good fit for either yourself or another individual, like that's part of our week. We're always helping other people access chiropractic around the country. And I'm always honored. I've helped people find chiropractors in other countries, in Europe and across the UK and even Australia, to help people get the care that they need with the right person. So, we're excited for you to take this information and, it helps you grow. We've done episodes about kind of going beyond the box and breaking out of the mold. And we hope that this helps bring light to the depth of what chiropractic can do for another person, because we've both experienced it for ourselves, and we've seen it for others 1,000 times over at this point.
Yeah. Yeah. The thing that made me fall in love with chiropractic was, I came to it because I was somebody in pain, but it was
Mm.
the changes in the function of how I was feeling, not just the pain, but
Yeah.
how I was sleeping and better breathing and all those pieces that really made me fall in love with it. And
Yeah.
if you're going through something, if you no matter what your diagnosis is, you really are better at having a healthy spine and a healthy functioning nervous system than not. So whatever you're going through, it's something that's really beneficial.
Awesome. Yeah. Well, thanks for being with us. This was an episode we were really excited to do because it's something we are passionate about, and that's what drove us to become chiropractors, and we're excited to share. If you have any questions, please reach out, and we look forward to sharing more experiences with you about the healing profession and also the chiropractic profession as we go forward. So thanks for being with us.
Thank you. And please, if you did enjoy this, please subscribe, rate, and review. It helps us so much with our channel.